direction, which are present in medicine, which are so necessary for organized work, any clinics, any activities which connect with medical staff and patient. Electronic medical and health records. We will discuss about this. What main question which we will see today? Medical records basics, electronic medical records and electronic health records, electronic medical records implementation, electronic medical record system in developing countries. Medical records definition, purpose, format, content, and administrative issue of the medical records usage. This in detail we will see in the group medical records basics. We will start from few definition about medical records. Medical records, health records, or medical chart is a systematic documentation of patient medical history and care. The terms medical records is used both for the physician folder, physical folder for each individual patient, and for the body of information which comprises the total of each patient health history. Purpose of the medical records. The information in the medical records allows healthcare providers to provide continuity of care to individual patients. The medical records also serves as a basic for planning patient care. Documentation, communication between the healthcare provider and any other health professional contributing to the patient care, assisting in the protecting the legal interest of the patient and the health care providers, responsibility for the patient's care, and documenting the care and services provided to the patient. The medical record may serve as a document to educate medical students, residents, physicians to provide data for internal hospital auditing and quality assurance, and to provide data for medical research. Format of the medical records. Traditionally, medical records have been written on paper and kept in folder. These folders are typically divided into useful sections with new information added to each section chronologically as the patient experiences a new medical issue. Active records are usually housed at the clinical site, but all the records are often kept in separate facilities. Content of the medical records. Content of the medical records may vary depending upon specialty and location. It usually contains following patient data: identification information, health history, what the patient tells the healthcare providers about his or her past and present health status. Medical examination finding what the healthcare providers observe when the patient is examined. Other information may include lab test results, medication prescribed, referral ordered to healthcare providers, educational materials provided, and what plans there are for the further care, including patient. instruction for the self-care and return visits. Medical records, general section. Demographics include information regarding the patient which is not medical in nature. It is often information to locate the patient, including identifier numbers, address, and contact number. It may contain information about race and religion, as well as workplace and type occupational information. It may also contain information regarding the patient's health insurance. The medical history is longitudinal records of what has happened to the patient since birth. It chronic disease, major and minor illness, as well as growth landmark. It gives the clinician a feel for what has happened before to the patient. As a result, it may often give close to current disease state. Medical record general section include surgical history, is chronicle of surgical performed for the patient, dates of operation, operative reports, and ethics. Medication and medical allergies, a summary of the patient current and previous medication, as well as any medical allergies. Family history lists the health status of immediate family members, as well as their cases of death if known. It may also list disease common in the family or found only in one sex or the other. Social history is a chronicle of human interaction. It tells of the relationship of the patient, her career and trainings, schooling, and religious training. It may explain the behavior of the patient in relation to illness or loss. Habits. Various habits which impact health, such as tobacco use, alcohol intake, recreation drug use, exercise, diet, are chronicle often as part of the social history. Immunization history. The history vaccination is included. Step by step, we try and understand what direction I include in the information about medical records. Medical encounters. Within the medical records, individual medical encounters are marked by discrete summation of a patient medical history by a physician, nurse, practitioner, or physician assistant, and can take several forms. Hospital admission documentation, here when a patient requires hospitalization or consultation by a specialist, often take an exhaustive forms detailing the entirety of prior health and health care. Routine visits by a provider family to the patient, however, may take a shorter form, such as the problem-oriented medical records. From this list question, you can find a large list information which collected about process, interaction, patient, and hospital, doctors. But this all necessary for correct and complete understanding what going on with patient, what they get, what prescription done have, and another information which we discussed before and in the future. Each medical encounter will generally contain the aspects chief complaint. This is the problem that has brought the patient to see the doctor. History of the present illness, a detailed exploration of the symptoms that the patient is experiencing, which have cases the patient to seek medical attention. Physical examination is the recording of observation of the patient. This includes the vital sign and examination of the different organ system, especially ones which may directly be responsible for the symptoms that the patient is experiencing. Assessment and plan is a written summation of what are the most likely cases of the patient's current set of symptoms. The plan documents the expected course of action to address the symptoms, diagnosis, treatment, and other. Orders. Written orders by medical providers are included in the medical records. This detail the instructions given to other members of the healthcare teams by the primary providers. Test result, the result of testing, such as blood test, complete blood count, radiology examination, X-ray, pathology, biopsy result, or specialized testing, pulmonary function testing, and other are included. Progress notes when a patient is hospitalized, daily updates are entered into the medical records documentation, clinical change, new information. Other information, digital images of the patient. In the other information can be included digital images of patient, flow sheet from operation intensive care units, information consent forms, ECG tracking, output from medical device such as pacemakers, chemotherapy protocols, and numerous other important pieces of information from part of the record depending on the patient and his or her set of illness and treatment. Administrative issue. Medical records are legal documents and are subject to the law of the country states in which they are provided. As such, there is great variability in rule governing production, ownership, accessibility, and destruction are included there. Electronic medical records, health records. Reason, this next paragraph we will see about electronic medical records. For begin, we discuss with you with medical records in general what part should include these documents. Now we will talking about electronic medical records or electronic health records. For beginning, we'll discuss about reasons and definition. This is both data type of electronic medical records or health records, electronic medical records issue, standards used within electronic medical records, and categories. For begin, so as you know, I think everybody saw in the clinic, in the hospital, paper forms, paper documents which stored about health history, your parents, your relative. And now, so fast, digital technology in the medicine also, and also in the electronic medical records direction also. In the previous lectures, we discussed about electronic medical information system, and of course, the so important part of medical information system, electronic medical records. And we step by step discuss about what is and what reasons, top of reasons to adopt an electronic medical records. Better access to data. Pull a patient chart within seconds rather than minutes. Never waste valuable time looking for a chart. Open and review your patient chart on any computer in the office with secure compliance software. Have 2 or more people work with a chart at the same time. Have clinical data at your fingertips when a consulting or referring physician calls. Open the patient chart on a wireless computer when you see him in the hospital. Access a patient chart online when he calls you with an emergency at 2 a.m. Simplify billing. More accurate insurance claiming submission, faster and easier accounts receivable management, customized and automated billing options, better charting. Never worry about illegible handwriting. Update medication and problems list with every visit. Important lab result, diagnostic image, and hospital discharge summarized into the patient records are added. You see this, not all list priority reasons for using electronic medical records. We understand about this, each direction in our life are in developing. This means every day we found new and new priority, ability, and sense. We understand also this direction are in developing. For example, 10 years before was one task and ability. In the today we have also new ability, new priority, and in the after 10 years this also will be more new priority and ability, and also this will be transforming and adapted. If we tell this all priority is completed, not we sure in the few time we will understand new one important cases which should include in the each direction. In our case, in the electronic medical records or in electronic health records will be added. We'll continue. Electronic medical records, electronic health-related information on an individual with one healthcare organization. Health records, electronic health-related information on an individual across more than one healthcare organization. Medical records, this one health organization. Health records is more than one healthcare organization. Personal health records, electronic health-related information on an individual managed, shared, and controlled by the individual. Overlap. The electronic medical records is the medical records in digital formats. In health informatics, and electronic medical records is considered by some to be one of several types of electronic health records. But in general usage, electronic medical records and health records are synonymous. The term has sometimes included the health information technology system which keep track of medical information, such as practice management system, which supports the electronic medical records. Data type in the electronic medical records. Record might include patient demographics, medical history examination and progress reports of health and illness, medicine and allergies list, and immunization status, laboratory test results, radiology images, X-ray, computer tomography, MRI, and another, photographs from endoscopy and laparoscopy, or clinical photographs. Medication information includes side effects and interaction, evidence-based recommendation for specific medical condition, records of appointment and other reminders, billing records, and advance directives, living will, and health power of attorney. Electronic medical and health records, general notes, ideal characteristics of electronic health records. Information should be able to be continuously updated. The data from electronic health record system should be able to be used anonymously for statistical reporting, for purpose of quality improvement, outcome reporting, resource management, and public health communicable disease surveillance. The ability to exchange records between different electronic health record systems. Interoperability would facilitate the coordination of healthcare delivery in non-affiliated healthcare facilities. Electronic medical records issue interoperability. In healthcare, interoperability is the ability of different information technology systems and software application to communicate, to exchange data accurately, effectively, and consistently, and to use the information that has been exchanged. Health information exchange. The mobilization of healthcare information electronically across organizations within a region of community. For example, in 2004 in USA, the Office of the National Coordination for Health Information Technology was created in order to address interoperability issue and establish a national health information network. Interoperability. The Center for Information Technology Leadership described 4 different categories, levels of data structuring at which healthcare data exchange can take place. While it can be achieved at any level, each has different technical requirements and offers different potential for benefits realization. Data type: non-electronic data, paper, mail, phones, call, machine transportable data, fax, email, and unindexed documents, machine organizable data, structured message in unstructured content. For this purpose are present HL7 message and indexed labeled documents, image and object. And next one, machine interpretable data, structured message, standardized content. This automated transfer from an external lab of coded results into providers. Data can be transmitted or accessed without transmission by health information technology a system without need for further semantic interpretation or translation. All the records in comparison to attain the wide accessibility, efficiency, patient safety and cost saving promised by electronic medical records, older paper medical records ideally should be incorporated into the patient records. The digital scanning process involved in conversion of these physical records to EMR is an expensive, time-consuming process, which must be done to exacting standard to ensure exact capture of the content. Results of scanned records are not always usable. Medical survey found that 22-25% of physicians are much less satisfied with the use of scanned documents image than that regular electronic data. Barrier and limitation. 80% of the work of electronic medical records implementation must be spent on issue of change management, while only 20% is spent on technical issue related to the technology itself. Our life often depends from our reflexes. What we did before, we so slow change to the new situation. And in this case, our so important change management, understand, create priority, and for people simply live as before. And change is spent a lot time and attention. Organization and social issues include restructuring, workflow, dealing with physicians' resistance to change, as well as information technology personalized resistance to design and implementation flexibility needed in the complex healthcare environment, and creating a collaborative environment that fosters communication between physicians and information technology project managers. Limitation in software, hardware, and networking technology has made electronic medical records difficult to affordable implement in small budget constraints, multiply location healthcare organization too. Now we see different side of process implementation electronic medical records. Are present limitation from hospital management, present organization social issue and tradition, and also a present limitation in software, hardware, and networking technology, also present. And only in collaboration all participants are available progress. Standards used within electronic medical records. There are many standards relating to specific aspect electronic medical records. RSTM, International Continuity of Care Records, a patient health summary standard based upon in the XML. The CCR can be created, related, and interpreted by various electronic medical record systems, allowing easy interoperability between otherwise disparate entities. In the world are present in the result interaction hospital management and developer and government structure. They did some principle law rule for organized information for understandable, visible, and comfortable for format storing and exchange information. Also are present few next formats for different group of data. ANSI, X12, a sort of transaction protocols used for transmission virtually and aspect of patient data, has become popular in the United States for transmitting billing information. HL7 messages are used for interchange between hospital and physician records system, and between electronic medical record system and practice management system. HL7 clinical documents, architecture documents are used for communicate documents such as physician notes and other material. DCOM are heavily used standard for representative and communicating radiology image and reporting. International society are constantly working in development and upgrading this rule and standards. In the world are present a lot it, and step by step now in the world so often start using this standard for highest quality communication. HL7, Health Level 7 standard, mostly widely used standard, general clinical messaging standard. Communicated structured data have a fields for diagnostic result, notes, referrals, scheduling information, nursing notes, problems, clinical trials data. 2000 hospital, the CDC and most referable label, also used in Canada, Australia, New Zealand, Japan, and extensively in Europe. Bridges many systems including laboratory, dictation, pharmacy, electronic patient records, performance database, data repositories, cancer registered, and another. And in this website we can find more detailed explanation about this format. You can follow this. Now we will talking about electronic medical records. Electronic health components, basics and full. Health info and data, order, entry. It's unnecessary for both medication order, also a lab order, and you can find not all are necessary for basic electronic medical records, but for another one we have it's not important. Labs, radiology order, send electronically radiology result, order sent electronically, result management, view lab result, view imaging result, image retain it, and clinical decision support also present, should be present. Electronic medical records implementation. Status, electronic health records adoption, development planning, and examples. I will see in this part of our lectures. On the base of research, which publishes the New England Journal of Medicine, we found research about only 4% of physicians use an extensive, fully functional system for electronic health records, and 13% use some form of basic electronic records. Those who use electronic records are generally satisfied with the systems and believe that they improve the quality of care that patients receive. For your understanding, world changing not so fast, but we in the university we should teach you not for yesterday, not for today, for future. When you will graduate it, you get specialization like 4, 5 years, 6. After this time, you should active use modern technology. And we understand after 6 years, our understanding, your understanding, and wealth understanding of principle and technology will change, but yes, main fundamentals will be same. And now you see we sure in the next few years this will be moving more faster. In the pandemic cases and another, electronic system become more wise, more useful. Now we see how growing these records continue previous year. For this time, I think is double present. This means fast growing, but of course it can be more fast. Status of electronic health records adoption. Percentage of office-based physician with electronic medical records electronic health records, United States. You see is growing percentage, but now we understand is double, but it's not completed yet. Effects of adoption. Electronic health record system. Quality of basic system and full function system. Percent. This based in the feedback of users. There we have basic function, and there we have full function. You see, if you use full function, your ability, your quality of clinical decision more higher. If you use quality communication with other providers, also is better when you use full functional system. Quality of communication with patient larger with full function system. Prescription refills also high with full, and this 95%. Timely access to medical records is around same, few larger full. Avoiding medication errors, this meaning more smaller mistake present. Delivery of preventive care, it's more high when you meet guidelines, it's more high in the full functional system. And delivery chronic illness care that meets guidance is more also high. Now we should understand from this, of course, if you maximum use electronic health records and you adapt it and you understand it, it's give for you more greater ability in the implementation in the service for your patient. Electronic health development planning. System implementation project in general experience low success rate. 28% project meet full success. 49% of projects are fully completed but over budget, over schedule, and lack full scope of planning functionality. And 23% of projects experience complete failure or are cancelled. Electronic medical record system implementation have even higher failure rates. Industry studies reveal failure rates of 50%, others as high as 70%. Planning for success. The key contributing factors to implementation failure reports were lack of planning, unclear vision, goals and approach, non-aligned with vendors, incentive, schedules, other practice, priorities and other resource responsibility. Incomplete, unclear and or changing requirement, lack of executive support and community, lack of resource dedicated to the project, staff, time, money and user involvement project, management and IT support. Unrealistic expectation for what can be accomplished and how quickly it can be occur. The electronic health records adaptation process. Billing, envision, evaluating, selecting, implementation, and stabilizing. We see steps which need which evaluate of implementation, adoption, electronic health records. And for your understanding, there's so large work for implementation, high quality of information system and electronic health records as part of it. And for this is a very large collaboration between software engineering, between users, these clinics, and patient. And step by step, this implementation and going. We should understand when we get chance create of information system, we should teach and training medical staff and patient how it using, and constantly we should upgrade it. Framework of electronic medical record solution. We have all information are transferring in the HL7 message formats. And we have different users. You can find around physician, staff, patient. We have matters usage, roles, configuration, insurance providers, and we have information SNOMED, drug database, and another. And in this process, constantly I exchange information between patient detail, between visit calendar, between clinical charting, and billing of patient or insurance company. This all should work in exactly clearly and comfortable for each users. How do clinicians interact with electronic medical records? We have patients, we have clerks, nursing staffs, physicians, coding staffs, and insurance company. And they interact with different kind of system. This registration system, this clerk, present laboratory system which interact different kind of user, pharmacy system, also radiology system, and billing system also. And for this support, a present decision support system which help in the optimized solution, found optimal solution for each cases. Example of electronic health record example are present there. We have, for example, electronic medical record system, which include information about patient, his immunization information, about his individual information, and there are present a lot list of records about patient. Okay, now we go next. Electronic medical records from screen, MedInotes, where present. You can find different interface, it's different. And there you can find different type of structure. But each company, each developer group create his comfortable for visualization. You can find there present information about task, what have scheduled patients, staffs, and different kind of information which are necessary there. Electronic medical records veteran affairs, for example, also present example, where we can find pictures about study of patient condition, and we have records of patient which are present in the result of study it. For example, we have a next one, medical system office OneNote, where we have pictures, where we have ability of working with images and electronic records, and we can fill and add some additional information. Electronic medical face sheet. Also, this is another kind of medical records where we can find calendars, okay. Now we continue. Okay, we have another example of medical records. This example we can find. There are present list records about what medication, what allergy, what social history. All these paragraphs are present there. Automated patient care, another one, electronic health system, electronic health record system, where also are present information about patient, about his symptoms, and different questionnaire present there. Pediatric electronic medical records, where we have pictures of a child, and we store all necessary information about it. Step by step, we store all necessary. This is another one example of scheduler calendar, where we can fill what exactly time we will working with our patient. This are present schedule, and this clearly understandable for patient and for staffs. This can be used. We select what patient we use and his contact present and what planned in calendar attendance. Electronic medical record system in developing country. Developing country issue, critical issue, and active and reporting system. For understanding, we should understand it's not so fast present communication and computer equipment, hardware and software not so fast development. In this country, not often enough money and educational people which understand it's important, and this also can delay process. Mobile population, limited means of patient identification, massive shortage of healthcare workers, physician access to the health service, limited infrastructure, limited access to drug, high disease burden combined with poverty, donor and aid agency requirement, privacy, confidential and security, delivery of specific health service by lay health worker task sheeting. You see a lot. This not all question, but we understand also this limitation. For now we live in, and uh, for us also not clear it can be possible, but really also this problem present. I think you saw from your life also some region where this really problem present. Critical issue. Approach a shift in perspective from reporting-based model of system design to a more learning-based approach whose main focus is on the direct care. Localization. System need to be adaptable and relevant to local needs and culture. This require that they be usable in local language properly. Understand data elements which vary by culture, such as personal name and addresses, and be able to manage appropriate clinical terms and concepts which describe local health care. Critical issue, we continue. Costing and ownership. Implementing organization must consider innovative approaches to managing the costs of development, licensing, development and support open source and open standards, and viable options to use alongside more traditional approaches. Local ownership of system must be encouraged and supported. Personal data protection. Patient data privacy and confidentiality is a key or concern and must be addressed by all systems, both technological and through policy and legislation. Business case. Electronic medical record system deployed in developing countries are driven by program management needed across districts, regions and countries. Active electronic medical records and reporting system. A very basic sampling of new one moment. Okay, and now we have a very basic sampling of your electronic medical records reporting system used in developing country, developed using different methodologies, sometime locally, sometime abroad. Career where United States and far countries, African, Caribbean, Asia, and are present different system which implemented Open MRS, Smart Care, you see in the different country are present his own or in collaboration for international system, which implement in the country. Yes, and now we can found some electronic records which doctors can store information in the mobile or in the different in the computer condition of patient. Of course, this limited ability there, but also this possible, and they try apply this knowledge. For this part, we will do now conclusion, and after that, I will continue another part lectures. In this lectures, we consider it next question: medical records basics, electronic medical records and electronic health records, electronic medical implementation, and electronic medical record system in development country. And these lectures are present in the server of Medical University. In the Moodle you can find it and you can use it. Now, shortly I will explain for you two important directions. Next, our classes will have two topics which we will study, so attention. First topic, it's about medical information system, which you should get experience, and we will try now check if this available. We will see how this work. In the previous lectures, I try show it, and we only will complete it. This topic 13, and I think this topic 14. One moment. Medical informatics, okay. Hospital information system, okay. And I will refresh for you. We can open EMR, and we try open it. There we have admin and pass login. Yes, we write admin and pass, and we will see now some example of medical records which can be present. Yes, medical information system can include some important information. There can be calendar, yes, this dependently of date. We can see maybe some present records for months, for example. Maybe we will see. You see where for each date can be stored some information. No, in this patient not present records. There are present information about patient. We have, for example, few patients, and there are stored his information about demographical, insurance, about messages, about reminders, different paragraphs which we discuss with you, for example, vitals, and also additional information about clinical reminders where present what a patient should do. For example, measure blood pressure, assessment tobacco, past due appointments, recurrent appointments, allergics. For example, there we have what allergies have, and medication which using, and immunization does present it. Also, we have history of different cases, reports. We have in the history information about this patient and about family history, relative history, lifestyle, and another one, which can be added. In the reports we saw it, documents where present information which give chance for us see what kind of information can be added there. This is comfortable formats is stored. Yes, after that we can attend transaction, create new transaction, view print blank referral forms, issue, and you see a lot kind information are stored there for more comfortable work of staff and patient. This we saw with you about records, patient records and electronic medical records. You see this example. In our practical class, we will see it and you should working with this. In your practical class, you should, we will invite you create in this system your own information and log in with your new patient. With you create your clinic and you will invite you create new patient, which will give chance for you get experience processing this information, electronic medical records, and working with medical information system. You see, with step by step, it's there everything open, and we can process it. Information about patient. After that are present fees, payment, what patient should do payment, in the what time, and total charge, and each there present from insurance, for example, we can detect, and payment against. Yes, everything are stored there. Modules of manage modules also this present, which help manage activity of clinics. Administration where present all staffs, all users. You can add yourself or another your friends to your clinical virtual clinic. Facilities, calendars, and reports. You see the so powerful and comfortable information system which can be useful. Of course, this present demo version are limited in the some amount of patient. Only for your training can be this used. If your amount patient become greater, this limitation, you not possible use this information system. But for studying, it's welcome and it's available. Okay. And now you found we can see how working medical information system, and in the detail we're talking today about DCOM formats, and we can find or load some pictures which present about patient. Please load DCOM study view image tags. Yes, maybe we will try load some images DCOM for our view. Maybe we will look now for our understanding. Information system and materials. One moment, I try found as possible fast. DCOM, yes, I found it. And for example, we can load these pictures, but we not open it. Load decom view image tags. Now one more time I will try load it. These pictures, and now we see decom. Oh, this one decom pictures. Need found way for correct load. Open. And we can select this image from computer. And now we will see how this will view. Medical, one moment. Information system. And there should be decom. Material. Decom. There should be decom, and I see where it is. This present decom. And we can value decom, for example, this. You see, we download these files. Some error present there. And we can view this image. No, pictures loaded, but some mistakes they are present. No, we will not spend now time for this. Maybe in the next classes I will show for you. But now I will show for you how working with Microsoft Access for your more clear understanding what we will ask you doing. Our task today in our classes, our task get experience working with database, and I will invite you get this experience, create a database, because all database which using in the electronic medical records or another part of wealth are useful. And some important principle our purpose is meet and create it. For example, your task will create by variants different database, and there present few important steps. For begin, I will open this task for your more clearly understanding, and we will discuss about this. This material, one moment, the practical task. For example, we have two groups of data about staff, about patient, anyone, and also we have another information which connected with them. For example, this can be information about papers, information about publication. And in our mind, we should understand, or in the paper, we should understand two types of information which we will have. Each database, for create database, for begin, we understand what we need. After that, we should define it of type of data which necessary for us. This means we should confirm what type of data present and what information they will include. And for this purpose are present tables which will conform, which will depend from which we should fill and conform. All information in the each tables, first step definition, part database, we should use after numeration, after number, which will define it exactly for each records number which added, and this function after number present. All another text can have text information, data and time, can have also some different numbers because, for example, in this space part we fill, and for each student we will add new one number. Next one, if we will fill information about patient, each records, for example, this we wrote for first patient, but there is number of records in the total in this part. This should be added number each records. For this purpose are present grade ID after number, and for student ID we fill patient number 1 or student number 1, come, and we identify his fields recorded. And next important part are present relationship between this database, between these tables, where we should connect one and another table, same fields, for example, student ID and student ID, we should add relationship. Fields were present after number, often we should put key fields which communicate there. And we should this add. Okay, and after that, after create this relationship, we should create forms which will illustrate about attendance, information about our patient. This form about student, and this forms about his grades from different subjects. Like this information we can store and found it and fill it. Now, this we will do this task in the next classes. After one classes, we will work in with queries and report. This I will show in the next class or in the next lectures, how we'll go in. I'm thank you for you, and our lectures is finished. Thank you.